involved with this movie and how it affected their lives, and then they can answer questions. It's a picky mic. So.
Thank you, Ben. Turnabout is fair play. First, I want to take all of your pictures for the Michael Moore website. So you want to wave a little bit so I can say, here we were. Okay, everybody wave. Happy. Now one this way, and then one the other way, and then I'll talk. A little bit. Yay, single payer. Awesome. Thank you. I understand this is the place where the constitutional amendment to make health care a human right in this state was defeated. Is that correct?
It wasn't defeated, it was sent to committee.
It was defeated by sending it to committee. Oh, don't you love sending it to committee? Isn't that nice? Oh, that's a surprise. Sandy says a committee that never met. What a surprise. Thank you very much for coming to see SICKO. I know a lot of you have already seen it. How many were seeing it for the first time today? Awesome. Awesome, that's great. Thank you for coming out on such a rainy day to see the film and for being active supporters of true health care reform in this country. My husband and I were selected for the film, very much like Adrian was. I sent in an email. I'm one of those 25,000 emails that came in. Very reluctantly, a college friend of mine had called me and said, Michael Moore's working on a film. I think you should send in an email. And I really trashed her idea. I said, that's crazy. I said, he doesn't want to talk about people with insurance. He doesn't want to talk about, he wants to talk about the people who have no insurance, not those of us who are middle class and losing everything we have. And thank goodness she called back a few days later and asked me again, did you send a message to Michael Moore? And I said, no. And she said, I think you should do it. So very late one night in February of 2006, when I was sitting alone in my computer room trying to work late at night while Larry was healing from his third heart bypass surgery, I sat there very alone and discouraged and angry and upset and demoralized and all the things you are when you've been defeated by our healthcare system, our for-profit system, and I typed out kind of a terse and angry message to Michael Moore and said, please, when you're making this wonderful film about healthcare, include something about middle-class Americans who worked all their lives and are losing everything. Much to my surprise, about 6 weeks later I got a call from a producer from his operation and started this wonderful journey that's been the last year. I don't want to take a whole lot of your time because the last time I was in Boston I spoke at Wellesley College at Hillary's alma mater, which was an interesting experience, and those young women are quite forward-thinking there too. But one of the things I tell people is that I remain acutely aware that there are 24,988 families who sent messages like mine, angry and hurting. Their stories are not on the screen. And that's just the people who emailed before they thought they could read no more, taking messages. So imagine if they had left that open for more than a week. That was 1 week's time. And I always am kind of fascinated by whatever the divine providence was that made me write that email at that space of time. Nobody got paid to be in Michael Moore's movie, and none of the people you saw in this film were actors or actresses in any way. None of their healthcare situations were fixed by being in the film. In fact, some situations were made worse. Adrian will share a little bit about hers. I'm one of the happy exceptions now. I've been speaking all over the country in the last 7 or 8 months about single-payer healthcare reform. I've now visited 26 states and the District of Columbia talking about not only SICKO, but about HR 676. And in January, I got a call from an organization that had been there all along the way for us since SICKO came out. These wonderful nurses wearing these red scrubs were there in Manhattan when my dignity started to return on a movie screen. And they were there all along the way. I kept seeing these wonderful nurses in red scrubs and had these interactions with nurses from one end of this country to the other. And in January, I got a phone call, and somebody from the California Nurses Association, the National Nurses Organizing Committee, said they wanted to set up an interview with me. And I thought, oh, that's nice. They're going to do another story about Larry and I and SICKO and all those things. So I didn't worry too much about this interview scheduling, and lo and behold, it wasn't an interview for a story, it was an interview for a job. So the happy news for myself and my husband is I took a position that was offered to me by that wonderful people. I now live in Chicago again. It's my hometown. I was born and raised there. Haven't lived there in 30 years, but we moved again. I moved to Chicago where I now live in the West Loop with Larry, and I have insurance benefits, which I hope to give up someday in favor of single payer. And I get paid now to help nurses spread the word about their work and their organization and about single payer healthcare reform. So my story has a wonderful ending at this point, a wonderful turnaround, but a lot of stories, as we know, don't in this country. We all know the estimates of those who die every year are low. The official U.S. estimate is 18,000 a year due to lack of access to health care. Families USA recently upgraded that to 22,000 because of a lack of health care, and there are others who estimate that that figure could be 10 times higher or more. And if we think about Massachusetts, just Massachusetts alone, 5 families today, 5 families yesterday, and 5 families tomorrow are burying someone because they had no access to health care. And we have to fix that. So I appreciate all of you and what you're doing here. You're awesome. Massachusetts is a beacon to all of us because of what's not working here. I hate to say that, but it's terrific that the mandates are not working as well as they would like. It helps us be able to say what we already knew and already predicted, that that's not the way to go for this nation. We all deserve health care. We're better people than this, and we're going to make it happen.
Kind of hard to follow that. When I wrote my email to Michael Moore, actually here in Massachusetts, living in a 500 square foot apartment with no insurance for myself, my husband, or my daughter. We both were born and raised in Michigan, and we had an opportunity to try something new and come out here to Massachusetts. About a month after we got here, we applied for Mass Health. Now, this was 3 years ago, so the mandated insurance wasn't in effect yet, but we applied for Mass Health. We were denied repeatedly. My daughter was denied repeatedly based on our income. Now, when you look at $1,000 for rent, food, daycare, you couldn't afford it we couldn't afford it on our own. There was no way. I tried getting it through Blue Cross Blue Shield, and about 2 months, I had it for 2 months, but then they dropped me because of pre-existing conditions. And I was left, they actually took back the money they gave to the doctors, and I was left paying those bills. So I think we ended up with about $7,000 within a year worth of medical debt that I finished paying off last year. But we moved back to Michigan, and you know that there was when Donna told me that this event was being taken, I had to come because of my experience out here. Being forced to buy insurance is appalling. You're just feeding profits to them, and I had to come. I felt it. It's more like closure for me. It's just to come out here and voice, what happened to me out here. It didn't make the movie. I did, tell them about it and showed them all the bills, but they were more interested in the fact that I used to go to Canada, and I still occasionally do that. But they were a little more interested in that, I guess. But that's it. I just want to take questions.
I'll tell you something fun about this young lady. You see my son, and one of the hardest parts of that film always for me to watch, and it has taken now 50 times of my seeing the movie is today. 50 times of my seeing it to feel rage about my son saying to me, "What do we do with people like you?" Well, I've always had this feeling that somehow what goes around comes around. And so I love my son dearly. He's a good man, but that's still a hard thing to listen to. So guess what God handed me? Kind of a new daughter along the way.